breathing so many times during the night. And I found myself sitting guard, standing guard the entire night. So I didn't sleep at all. Maybe I dozed off a time or two, but I spent the majority of that night going in and just shaking that person. Now, the wife doesn't sleep with him because of the snoring. And yet here's this person, and I thought, I'm going to be in this group where somebody could possibly not wake up in the morning. To me, I have a CPAP. But I thought it was a bunch of BS and just another thing that I needed to buy, another piece of contraption that was going to interfere with my lifestyle. And I just thought it was a big hype, and I don't even use it. So you can imagine the conversation that ensued following that. And now this person is not only using it, but very thankful for that bit of information. And I think that is as important as not bringing it up, as following through with when we do bring it up. Please go have a sleep study. Here's your CPAP. Now what? And we're going to talk about that too.
The crossing back and forth of time, it really does disrupt our brain clock. And it takes about 1.6 days, they say, for every hour of time. We can self-induce jet lag by not going to bed at regular times. So we stay up 2 or 3 hours late one night, and then we get up at the same time the next morning. Our body has lost those hours, and it's the same effect as if we change time zones. How are they ever going to have time to do that? How are they supposed to do that, and who is supposed to do that in their office? And I stood up and said, we will do it.
Yes.
Let us do it. Nurses, hygienists, let your staff do it. And I said, not to whatever, but like these conferences, there's doctors and doctors and doctors, and you're discussing the issue, you're discussing the problem, you're discussing the lack of compliance and the frustration you have. But where are your teams?
Well, we're going to dive deeply into that. Than those of us who are recommending a water pick to our patient to use at home. There are some of us that are still saying, go to CVS and buy one. There's still some of us that are saying, here's the box, take it home, read the directions. And there's some of us that are taking the pieces and parts out, throwing away all the cardboard and plastic, filling it up with water and showing them how to use it. Which patient is going to have more success using that tool at home? Now, then you take it a step further. Are you bringing your tip in with you when you come in for your recare? And are we reviewing the use with the instrument in hand or the toothbrush or whatever it is? And imagine sending this box that we're supposed to now strap on our face all night or in our nose all night. And we think we have trouble getting compliance with a water pick or clear aligners or something like that, right? We believe as healthcare providers and nurturing caregivers that we have to be able to lay out all of the steps before we can do it, or we have to know everything about it before we can talk about it. And it's about taking that first step, and then what does the support look like? So, yet we're in a profession, we're in a profession where we have two hands, foreign instruments that are metal and sharp, lights, and suctions, and we are right in that environment. So even those of us who can sit through a dental appointment feel that. Imagine those who are struggling to get air on a regular basis and their brain is already programmed to be considerate and concerned about that. So the psychology of what we do when we have somebody who's afraid or needs a break or needs the suction or needs another rinse, those ones that we often, say, here comes Mary. We need to add 15 minutes to her appointment. We begin to explore the reasons why. And the beauty is, once we see something, once we learn it, you cannot unsee it.
Depending on how low their oxygen levels are coming during the night, which you won't know unless you test. So it's not enough just to screen. You would never just ask somebody, what is your blood pressure? Do you think you have high blood pressure? You take it. So the testing, the screening and the testing becomes important, because if they're dropping below 90, they're losing cells. They're losing brain cells, right?
I bring that back to periodontal disease. And one of the most common questions that we are asked when we're working with teams is, how am I going to tell a patient that I've been seeing for 20 years that they have gum disease when I've been seeing them every 6 months, right? So it's the same analogy that we can use with this. But the biggest, and I'm going to give you a huge nugget right now, if you want to capture the attention of your patients, here is a statement that you can make for them regarding anything we're doing, and it's not your fault.